I work for the Centre for Public Policy, and we've been working with NVLS on this one-day conference looking at rethinking health inequalities, because we think that's the big issue that Scotland's got to grapple with. And the Centre for Public Policy is the place where evidence meets practice. So we know that Scottish life expectancy is at a lower rate than that of the rest of the United Kingdom, and we know a lot about the reasons why. What we don't know is why our political communities aren't responding to that. What is it about the way that we make public policy that is failing those communities that deserve a better life chance than they currently have?
People don't experience illnesses as single conditions. You know, they experience illnesses as all of the things that are going together in their life at the time. And policy is a bit like that as well. It's a bit siloed, so we're only looking at this bit or this bit or this bit. And so hopefully bringing everyone together to think about all these determinants on our health, how they interact, and how actually what we need is systemic change. If what comes out of today are things like us just acknowledging that a bit more, but also finding ways that we can work together and leverage some of those relationships that will help us think about that in the future.
Yeah, we've collaborated really well between Public Health Scotland, the NHS and Glasgow University in the past. For example, we worked together on minimum unit pricing for alcohol. Well, what I really like about the gathering we're having today is that it's bringing together so many different disciplines. So we've got colleagues here who are really helping us work out how to engage with and influence policymakers and politicians nationally and locally. We've also got work going on about how best to tap into the expertise that exists within our communities, together with the academic expertise that exists. So that's what I think we need more of.
So we spend a lot of time at the Centre for Public Policy bridging that gap between academics and their research and the public policy community and the politicians that make a lot of the policies and rules and laws that govern society. We want to bridge that gap by bringing people together, understanding each other's world and using the tools that they require to make a difference.